It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells along with Jim Knox, and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Dallas-Fort Worth area that are really changing people's lives.
That is exactly right, Grace, and let's start the show with one of the best plastic surgeons in the entire Dallas-Fort Worth area. It is Dr. David Azouz.
I had my gastric bypass in May of 2011, and after 2 years, I lost 100 pounds. After losing 100 pounds, I had a lot of excess skin on my belly. I've always been big around my belly area, so that's where I carried all my weight. I felt very unhealthy with it and wanted it removed.
The problem is when you lose that much weight, your body and your skin cannot go back to where you would like it to go back without help. And there's no way with exercise that you can get rid of the extra skin that's hanging, that has been stretched out, often has a lot of stretch marks. And in some patients, you do need to do a brachioplasty or remove skin from the arms. In some also you need to do a breast lift. In some you have to do a facelift to correct the extra skin around the face. So everyone's a little bit different. In Karen's case, her major problem was her abdomen, where she had all this extra skin and this pannus that she wanted removed, that she could not get rid of, despite the fact that she ate well and despite the fact that she was working out regularly.
When I came to see Dr. Azouz, I weighed 151, and that was because I was still carrying all the fat that was around my belly. He had explained to me the different procedures that he has. He explained to me the tummy tuck in particular. It was what I was interested in. When he examined me, he found a hernia, which he repaired while he did my tummy tuck. Dr. Azouz cut off 8 pounds of fat from my belly.
And of course, her skin was very poor quality. It was all had been stretched out from when she was a size 24 or 26.
Once I had my tummy tuck done, I dropped like 4 sizes right away. Dr. Azouz told me when I had the tummy tuck, I would lose another 20 pounds plus what he cut off, and I did. I started at 248 before my weight loss, and after my tummy tuck, I'm now at 124, size 0.
What we do here is what's called a dermatopathology laboratory. It's a special type of laboratory where we look at skin biopsy specimens primarily. We get a few other things, but the vast majority of what we get are skin biopsy specimens. We see a large number of cases on a daily basis, so we see just about everything in the textbook over the course of a year.
By helping him, it allows him to do more and read more cases, be available to more physicians, while I do some more of the little stuff.
We have kind of an integrated approach where in the mornings, we come in and we look at the slides first. This is a 24-hour operations lab, so the slides are available at 4 in the morning, even if you want to come in that early, and sometimes we do. Then, when he comes in, he reviews the slides, and we're there with him. So he gets an opportunity to see what our impressions were, and you learn, he can kind of give you an idea of whether you were on base and doing it correctly, or if you needed a little more work.
As dermatology residents, we come to Dr. Cockerell's lab every week, sometimes multiple times a week, where he teaches us at the microscope his specialty, dermatopathology, for which he's world expert. So it's a great opportunity.
The fellows are a very good resource for us. They help us with some of the mundane type of tasks that have to be done in the laboratory, but they're also very creative, and we work together on a number of projects. We've published papers, textbooks, many articles together. We've actually done some significant research work that's been published in major scientific journals with some of the fellows over the years.
It's an honor to work with Dr. Cockerell. He is one of the best, if not the best, in his specialty. As a person, he has an amazing ability to recall information in a short amount of time. We consider him as to be the walking Bible of dermatopathology.
It's been an invaluable opportunity to learn from someone who is not only world famous in his field, but a phenomenal teacher and physician.
I think they learn from me, but certainly I enjoy interacting with them, and I learn things from them too.
Hi, I'm Dr. Harvey Carter with the BestDocsNetwork.com. Crystalline surgery today can be done on patients before they develop a cataract to reduce or eliminate their need for glasses. For more information, you can watch my videos on BestDocsNetwork.com.
If you have asthma, don't let it stop you from playing sports. Swimming, canoeing, fishing, sailing, and walking are all asthma-friendly options.
We are excited to welcome in the studio Dr. Preeti Malladi. She is one of the top minimally invasive bariatric and general surgeons in the entire Dallas-Fort Worth area. Doctor, welcome to the program, and let's get right into it. Who's the perfect candidate for bariatric surgery?
Well, obesity is a spectrum, and some patients need to lose a lot of weight, and some patients need to lose just a few pounds. And bariatric surgery is meant for the patient who needs to lose a lot of weight. So we measure this by body mass index, which is a combination of your weight and height. It's a formula. And we look at patients who have a body mass index over 40 or a body mass index over 35 with other obesity-related medical conditions like diabetes, high blood pressure, heart disease. So that's one way that we look at candidacy for surgery.
All right, very nice. Now I hear that insurance, possibly insurance, can help out. Is that the case?
That's absolutely the case. The only thing that people need to understand is that bariatric coverage is almost like having dental coverage. You either have it or you don't. It's not under general coverage. And so if a patient doesn't have coverage, then we can work with them with financial planning. But if they have coverage, then there are certain criteria that the insurance companies require you to meet. But in our practice, we help them understand if they have coverage and also to go through all the requirements to help them get approved.
There are different types of bariatric surgeries. Can you explain what is best? How would each individual know what is best for them?
Well, the most common bariatric surgeries are the laparoscopic adjustable gastric band, the sleeve gastrectomy, and the Roux-en-Y gastric bypass. And those three operations have different pluses and minuses. And I really encourage a patient to talk to their doctor because it's really based on the patient's medical and surgical history and some other medical conditions that they may have, because each operation affects medical conditions differently. And so I would say it needs to be a conversation with the physician involved.
Dr. Malladi, you are a minimally invasive surgeon, so what does that mean?
I actually did a fellowship in minimally invasive surgery because I wanted to make sure I could get the best outcomes for my patient. And traditional surgery requires a large incision.
To see the rest of this interview, as well as other outstanding videos, head to BestDocsNetwork.com.
For more information and to check out hundreds of videos, head to our website. It's BestDocsNetwork.com. Now I know when I'm looking for a doctor, it's important to me how they make me feel as a patient. So up next, we're going to hear about the patient care and practice philosophy of pain management specialist, Dr. Jason Williams.
When a patient comes into the clinic, I want them to feel very welcome. I want to have a clinic that's a nice, warm, inviting atmosphere. I want to treat them as I would a family member, my own family member. The first person they see is Sonia. She's the receptionist, office manager, kind of the patient go-to person for any needs that they might have. She's always makes it a point to welcome every patient, make them feel invited, make them feel comfortable, and let them know that she's there for anything outside of the medical treatments that the patients might need.
We really do like to get to know our patients as much as possible on a more personal level so we can individualize their treatment plan and help them in any kind of recovery process in order for them to be pain-free and make it as smooth as possible.
The second person that a patient meets is my nurse, Kelly. She's very instrumental in the treatment process for me. And then she's very instrumental in the backside of things, and so is Sonia. Kelly's very instrumental in the post-operative or the post-treatment plans. She's pretty much the go-to person to talk to when patients have any issues whatsoever post-operatively.
Through my professional experience, I'm trained to care for all of his patients in the pre-op and the post-operative setting by providing education and what to expect during their visit, during their surgeries, and then also in their post-operative care. Initially, when I meet with Dr. Williams' patients, I review their history, their major complaints on why they've chosen to come to Dr. Williams in order to provide the absolute best information that I can for Dr. Williams to perform the surgery.
When patients come in, they may have a lot of questions about their pain and treatment options, and we are always here to answer any questions that they have.
From the moment a patient walks in my door and they meet me, I want them to understand that I'm going to take the time, do what it takes to get them from the point they are when they meet me to a point where they're 100% pain-free, no matter how long it takes.
Don't forget, for more information about any of our outstanding doctors you see on today's show, Grace, everyone just has to go to the website. It's bestdocsnetwork.com, bestdocsnetwork.com.
Now up next, we're going to hear about some non-surgical options for aging skin with Dr. Naila Malik.
Aging is a multidimensional process which starts in the surface and involves subsurface structures, including skin, fat, muscle, and bone. So the way we determine the best treatment for anybody's aging face is by looking at the extent of aging they have in each one of those layers. The CO2 laser will address your skin surface problems like texture and fine lines and deep lines and some collagen elastin production. The radio frequency will address the skin tightness below the skin, and then you can use dermal fillers such as Radiesse or hyaluronic acid fillers to account for the loss of fat that occurs with aging as well. It is important to know what your patient needs based on their face shape and the type of aging you have. When I saw Jennifer, she originally came in asking for an option of a filler for her fine lines and deep lines above the lip and nasolabial folds. But after examining her, I determined that the CO2 fractional laser was probably the best choice for her. And she had the added advantage of having a tremendously great response to the CO2 laser by improving her elasticity.
My only knowledge of cosmetic procedures was filler and Botox. And I was told that I would probably need a facelift a few years ago by someone else, and I was dreading the thought of going under the knife, and that wasn't for me. So I was very thrilled when she told me this is basically a facelift. And sure enough, I had it 5 days ago, and I am absolutely thrilled with the results. And what's even more exciting, she says the results are even better as you go a few months down the road. So I'll continue to see improvement. I am completely blown away that for as simple of a procedure that it is, it has completely changed my life.
The response of each individual patient to these treatments is very, very different. It depends on their genetics, on their lifestyle, and so many other things, the amount of stress they may have at that time. So you cannot really have a cookbook that every patient is going to need the CO2, radiofrequency, and dermal fillers, even if they look the same at the first visit. So you really have to step back and look at their results and see how the results show up over the next several weeks before you decide to do a second treatment.
The Best Docs Network is all about doctors helping change people's lives. It's educational, informative, and real. Log on to bestdocsnetwork.com.
Gynecomastia is a very important part of our practice that I enjoy doing. Gyneco means woman-like, and mastia means breast or chest, so it's a woman-like breast. On a man, that means not just necessarily obesity, but also the glandular tissue that comes along with it, which is the hard, fibrous area that you can actually feel under the nipple and the areola. We see many young men who get it with the onset of puberty, and then we see many men in their 20s, 30s, and 40s who have no antecedent cause for this. Gynecomastia surgery traditionally has not been a very satisfying operation for either the surgeon or the patient. And the reason why is 99% of surgeons are still doing the same technique that's been done for the last 80 years. They put the patient to sleep, they make a 3 o'clock to 9 o'clock incision around the areola, they start cutting out the tissue under direct vision, then it starts bleeding, they can't see very well, they may get a contour problem or a depression, and then ultimately they put drainage tubes in from the side to drain out the fluid. So about 9 years ago I came up with a new idea. No scar at all on the chest, no drainage tube. We're able to remove the two components of gynecomastia, the fatty tissue and the glandular tissue, through an incision this long under each arm. And there are two instruments that allow us to do this: the use of ultrasonic liposuction, and we have a multi-jointed cutting device. We're able to cut out the rest of the glandular tissue with an instrument that goes through this incision all the way down to the nipple. After we've cut all it out and it's perfectly flat, the last thing we do before closing the incisions is to re-inject the entire field with a long-acting anesthetic called Marcaine. So when the patient gets up, we've already got the compressive garment on, they're pain-free. They're typically only in the recovery room 45 minutes to an hour, and that stays numb till the next day. They wear the compressive garment under their street clothes for 3 weeks, and they're done. We see them at 8 to 10 days post-op, or we see them 6 weeks after that, 3 months after that, and they're delighted.
Welcome back to the Best Docs Network. In the studio, we're pleased to be joined today by Dr. Harvey Carter, owner and founder of Carter Eye Center and one of the top cataract surgeons, not only in the Dallas-Fort Worth area, but in the country. Dr. Carter, thanks for being with us today.
Thank you for having me.
Now, you were the first doctor in the United States to perform the crystal lens procedure once it was approved by the FDA. Can you talk us through the procedure and how it works?
The crystal lens procedure is where you do a cataract implant operation, and cataract implant surgery is done with an implant lens where we replace the cataractus cloudy lens in the human eye with this implant lens. The crystal lens allows the patient to develop a wider range of vision after surgery because the lens is the only lens approved by the FDA to accommodate or focus in the human eye, which gives you the widest range of vision from near, far, intermediate in terms of a range of vision, allowing the patient to get some degree of spectacle freedom.
At what age do you normally see cataracts forming?
I'd say roughly 2 out of every 3 patients over the age of 60 have some degree of cataract development in their eye. The average age of the roughly 3.5 million or so patients who had surgery in the United States last year was probably around 72 years of age. So it's a painless, progressive, gradual loss of vision over about a decade or so is when patients start to notice it. The first signs and symptoms will be things like glare, halo, difficulty night driving, inability to see the television, different activities of daily living that'll just start to become impaired as you get into your 50s, 60s, 70s.
And do I understand correctly that you don't necessarily have to have a cataract to be a candidate?
Well, that is true. If you take and look at the operation, cataract implant surgery, which is where this came from, involved taking the cataract out and putting in this monofocal lens implant. And that's the most popular #1 procedure.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Let's talk about gluten sensitivity. You hear a lot about that. People with gluten sensitivity tend to get bloating, gaseousness, but it also can cause things like anemia or fatigue because it washes out your nutrients in your body and causes changes in everything from your energy level to your tests in your doctor's office. Gluten sensitivity is caused by the absence in your small intestine of an enzyme that digests gluten. Gluten is like wheat, breads, and that kind of thing, and starches. If you don't have that enzyme, you build up gas from all the gluten that we tend to get in our diet. How can you tell if you're gluten sensitive? Well, one way is to just take gluten out of your diet. All you have to do is look on the internet and you'll find gluten-free diets. If you get better from your symptoms that worry you by being on a gluten-free diet, then you probably do have gluten sensitivity, and just keep on keeping on that way. Now, one way to tell for sure is you can get a biopsy done in a doctor's office with a scope down your throat, but that's not the best way to do it. Just get a blood test done if the dietary restrictions don't work.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
For more information about any of our outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. Right now, it's time to head to our next best doctor. It is prosthodontist, Dr. David McFadden.
I had started very early in my 20s to get a lot of dental work, crowns, and then in my 30s I realized it wasn't going to last forever, and this created some problems. Not only is it expensive, but it takes your time and it's uncomfortable.
Implant treatment has really been a great technology for patients whose teeth have reached a point where they can't be restored. Teeth that reach that point either have broken off, have decayed, or are just so broken down that we can't use them anymore in the reconstruction process. In those patients who have reached that point, we recommend removal of the teeth and reconstruction with dental implants. Sue had been plagued by a lifetime of dental problems, including decay and tooth loss. She had reached a point where we did not feel comfortable saving any of her natural teeth, so we decided we'd do a reconstruction for her with dental implants.
My friend Kelly is in the dental educational field, so he's very meticulous and precise. So you always go to the person that's best suited to the job. And in this case, it was a prosthodontist. Kelly said this was the only place to do it, and so this is where we did it. And he was right.
Sue was referred by a very close friend of hers who is a dentist here in Dallas. I was honored to get that referral because they had researched her needs and visited many offices before deciding to come here. What they found in their search was that a lot of the other practices were heavy on sales and very light on education. What they liked about my approach was that I simply gave them their options and was able to show them similar cases so they could make their own decision.
Dr. McFadden is very easy to talk to. He can take a joke, he's got a sense of humor, he's serious when he needs to be. He's very thorough, both in the procedures and also letting you know what's going to happen and how he's doing it.
Many times, patients' dental situations have deteriorated to the point where their whole mouth needs to be treated. Many people can't afford that, so we try to stage their treatment in a way that we have good stopping points along the way so they can regroup and plan for the future.
Hi, I'm Dr. Preeti Malladi with Best Docs Network. Did you know that obesity can increase your risk of sleep apnea and that bariatric surgery can help? To learn more, watch my videos on bestdocsnetwork.com.
I was very apprehensive about coming into preferred imaging. The night before, I had read every negative thing that could happen when you have an MRI. So when I came in the door, the secretary met me, just smiled. And the technician for the MRI was just really helpful, very reassuring. I was so happy I'd come to preferred imaging.
So I had saw a physician out of town, and he had looked at both MRIs and was wanting to order a different MRI. And he preferred the one for preferred imaging better than the other one and asked me would I return here for the one he was ordering. So we did, and he was very pleased with the second one that I had here as well.
And the setting, the waiting room, and the changing room all were really nice.
Their room is really painted pretty neat. It's very artistic, and just kind of makes you feel like you're not in that normal cold hospital type feeling, just more of a warm type feeling.
The staff was uplifting and answered all my questions, and the procedure was so stress-free. The technician gave me a button to push if I needed help instead of wiggling my feet and trusting that somebody was going to see me. The first thing I did when I was inside the MRI machine was to test the button, and she immediately came and pulled me out and said, "What do you need? Is everything okay?" And I was like, "No, I'm just testing the button." And she was like, "Oh, that's okay. I just want you to know that I'm here and I'm watching you and you have the button." And so that was very reassuring. And then the procedure was just like they said. I had an absolutely fabulous experience at Preferred Imaging.
I also live 2 hours away, but I am in a small town and the imaging there is mobile and it's not very well. So I do travel up 2 hours so that I can get good quality imaging. And so when the doctors like it and prefer it, it's worth the drive of 2 hours.
They're really friendly, really nice, very helpful. It was I really did have a good experience here.
Find out more about your family history. Finding out what your grandparents died of can provide useful and life-saving information.
Well, I've kind of always wanted to have larger breasts, but I was married and my husband didn't want me to do it and had a bunch of kids, and so I had a life change. In the 90s, one of my good friends had used Dr. Barnett, and she goes, "Kim, you're starting your life over, go see Dr. Barnett."
A breast augmentation is where there are several incisions. The only one that makes any sense is right here where the crease is. You make an incision, you open up a space for the implant to sit in. Very important to put it on top of the muscle. You make a space. You have already decided what size implant that they need. Why? How do you decide what they want, what they need, how big have they been, how big are they now, how tight is their skin? Or you make the operation fit the patient rather than vice versa.
Afterwards, I was here for hours recovering, and I had a friend take me home, and I slept through the night. Waking up, I had very little pain. After about 4 or 5 days, I was pretty comfortable in going and doing. I took a couple days off of work, and then I was back at work.
When Kimberly came in, she needed some changes in her life. She needed her breast done, or wanted them done, and she wanted a new figure. So that's what we did.
It's great. I love it. He did a great job, and I'm very happy with it.
Her breasts are fabulous, if I do say so myself, which I will. They fit her body. She told me a minute ago she looked like she does now when she was 28 years old. And that's what we did for Kimberly. We just gave her a boost in self-esteem. She's happy. It's win-win all the way around.
Dr. Barnett was very personable, very funny and nice, and he takes time to know you, and he lets you know him. And so then you kind of have a relationship before the surgery. So you feel very comfortable, and you trust him, and it was a great experience.
Wow, those were some life-changing stories on today's show, weren't they?
Exactly right, Grace. You know, more life-changing stories, of course, on the website, bestdocsnetwork.com. Anything and everything you want to know about some of the best doctors in the Dallas-Fort Worth area, head to the website, bestdocsnetwork.com.
And if you have a question or comment or a life-changing story of your own, we would love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.